looking at osteology, or the bones or the head and the neck. This is our head here, and the bones or the head collectively we call that as a skull, and these bones are going to be interconnected. You can see, for example, you can see this line that is running. They are going to be interconnected by sutures, and sutures are a type of joint that does not move, immovable joint. And in the fetus and the newborns, these bones, you are going to have spaces between them. The spaces, we call them fontanelles. These are membranous and unossified gaps. The bone has not yet formed there. And the reason as to why we have got fontanelles in the fetus and in the newborns is to allow the head to be able to deform as the child is coming out during birth. And also just to allow for growth, because as we get to grow, there is expansion of the brain that is happening and such. There are different types of joints that you are going to see in the head and neck, but the main ones you are going to have, the largest joint is the temporal mandibular joint, that is between the mandible and the temporal bone. You are going to be able to see that. And then you are also going to have synovial joints. For example, in the middle ear, you are going to have the malleus, the incus, and the stapes. The joints that connect these bones are synovial joints. Most of the joints in the head and neck are sutures, adding on the temporal, mandibular, and the other synovial joints. So the skull has got 28 bones. Some of the bones are paired, others are not paired. For example, the frontal bone is not paired, it's just alone. But if you look at the zygomatic bone, the one in blue, these are paired. You have got on the left and on the right. Okay. So of the 28 bones that we have, 8 of the bones will make up the calvaria. The calvaria is the part that will cover the brain, the top part. And then 13 of them will make up the face. These are the ones that you can see colored. We call them facial bones. And then 6 of them, they are going to be found in the inner ear. We call them auditory oscles, the malleus, incus, and the stapes. Because we have got 2 sides, that's why they are 6. So generally, the bones of the skull, we can divide them into the viscerocranium and the neurocranium. Visceral, this is covering the face, and these are the bones we can see in color. While neurocranium, these are the bones that will be able to cover the brain, protect the brain. This is the one that is not colored. The calvaria is you just getting a part of the neurocranium, just the top part of the skull that is going to enclose the brain. That's what we call the calvaria. When you are looking at the head, you have got different views, 5 views in which you can look at the head. You have got normal verticalis, normal occipitalis, normal frontalis, normal lateralis, and normal basalis. For normal frontalis, we are looking at the head from the front. Okay, frontal bone. Even the frontal bone is in front. So that's the normal frontalis. These are the bones that you can see. And then normal lateralis is you looking on the lateral aspect, and this is the view. Normal occipitalis is you looking from the occipital end or the back, and that's what you can see. And then normal verticalis, vertical is upward, right? So it's you looking from the top. Normal basalis is you looking from the bottom. You are looking at the bottom of the head. So these are the views that you're supposed to know. Don't worry, all these things that you can see here, you are going to know them in 1 month. It's good that you have started early because there are a lot for you to know, as you can see. So starting with the facial bones, the bones that make up the face. As we said earlier, you have got some which are paired, others are not paired, and we've said we have got 13 bones that make up the face, of which some are paired, others are not paired. We have got the nasal bone, and these are 2, just on top here. Okay. We have removed the part here that makes up the nose because it's not bone, it's actually cartilage. That's why you can see it's not there. So nasal bone, they are paired, And then we have got lacrimal. Lacrimal refers to, you hear of the lacrimal gland. This is a gland that will be producing tears, so there's a relationship with the tears there. So the lacrimal gland is on the sides, inside, and they are also paired. So that makes four. You also have the zygomatic bone, which we also call the cheekbone. When you are smiling, the cheekbone there, and they're also paired. That makes up six. We have got the inferior nasal concha. Now you can see for the nasal concha, these are bones. You are going to find them in the nose on the lateral aspect. And these are actually three. You have got the superior nasal concha, the middle, and the inferior. The middle and the superior, they are part of a different bone that you are going to see. The inferior nasal concha is a different bone. It is alone. And you can see they are also paired, so that makes up eight bones. You also have the vomer, which is a bone of the nose also, but it is just alone, it's not paired. So that makes up nine. The maxilla is a paired bone. You can see there is this separation on the middle here. So that makes up 11, isn't it? And then you have got the mandible. The mandible is just alone. It is unpaired bone. Okay. And then the bones that to make up the cranium or the cranial bones, not the face, you have got, can you see the ethmoid bone? Okay, let me start from the top. The frontal bone. You have they are unpaired, is just alone. The parietal bones are the two of them. They are going to be separated on top. And then you have got the sphenoid bone. Sun is a very interesting bone. Don't worry much. But can you see that it's actually going to make up part of the orbit? The orbit is this region where you find the eye. So you just understanding all these bones as we are describing them, because looking at the orbit is going to be another topic. It can save you some drama, right? Because you can already see what bones are making up the orbit and where they are located. The sphenoid bone, you are going to see it posteriorly there. The ethmoid bone, you can see it there, and this is what will give you also the superior and the middle nasal concha. And then the temporal bone, which you can see here, and the occipital bone. Occipital bone is unpaired, it's just alone, just like the frontal bone. The orbit is gonna be another topic. We will look at it as a topic. So I just put it here. You can see the bones that make up the orbit, but don't worry about this much for now because it's another topic. If you look at the ear has got three parts and it's going to be a topic on its own, so don't worry much. You have got the external ear. We'll talk about this in neurophysiology. We'll talk about it also in neuroanatomy. We'll talk about it also in head and neck. So you can see the revisions that you'll be doing. That's a goodness of neurosciences. The external ear has got mainly the pinna, where I've got the auricle, and the external auditory meatus. The middle ear mostly contains, you can see this tympanic membrane, okay, and also the bony ossicles. So the bony ossicles are part of the middle ear, and you have got three. The first one is the malleus, this comma first one here. Second one is the incus. The third one is the stapes. The stapes is connected, or yeah, is going to connect to this shell thing that is looking like a snail. This is what makes up the inner ear, and this thing that is rounding like this, we call it the cochlea, and then this first part here is the semicircular canals. Not just semicircular canals, you have got different parts here. I don't want to talk much about that, but these two things that you can see going on top there, there are three of them. Those are the ones we call semicircular canals. They actually help you to be able to tell if you are moving your head to the left, to the right, up, down, to the sides. It will be able to tell you that you are moving your head. And then we have got this dilated part here. You have got what we call the circle and the utricle. Those are going to help you in telling if there is linear acceleration. This part that is round, cochlea, helps you in hearing. This is the organ of hearing. These I've mentioned here, the semicircular canals, the sacral and the utricle, they are used for balance, for you to be able to say, okay, my head is up straight, I'm moving forward, I've now turned my head this side. That's a function, but I don't want you to worry about that. We'll discuss when the time comes. What I wanted to mention is that the middle ear has got small bones, the malleus, the incus, and the stapes. These are the ones again that you can see. The malleus is actually attached to the eardrum or the tympanic membrane. The incus attaches the malleus to the stapes. The stapes is the one that attaches the cochlea in what we call the oval window, but don't worry again there. Let's talk about the sutures that make up the head and the neck. So on the sutures, you are going to, some of them you name them just by looking at the bones that are connected. This is a zygomatic bone. This is a temporal bone. So the suture is zygomatico temporal. And then you can see again, this bone here is a sphenoid, this one in orange. And then the one in green is a zygomatic, so that would be sphenozygomatic suture. And then you can see this bone here, this is the parietal bone. This bone here is a sphenoid bone. Don't confuse with the zygomatic. The zygomatic is this one. So that will be sphenoparietal suture. And then some special names of sutures, the one that separates the two parietal bones, we call it the sagittal. Remember the sagittal plane? So this will be the sagittal suture. And then you have got this suture that is separating the parietal on top from the temporal down. That is a squamous suture. You have also the suture that will be separating the two parietal bones from the occipital bone. That is going to be the lambdoid suture at the back. And then the one that is separating the frontal bone from the two parietal bones, that is the coronal. Remember the coronal plane? Coronal suture. We also have, during childhood, the frontal bone is actually two different bones. We have got what we call the metopic suture there. But as we get to grow, those bones fuse completely. That's why it ends up becoming only one bone. That's a metopic suture. And for these sutures, the lambdoid, the coronal, the sagittal, these ones take more time for them to close. The metopic suture, the one which separates the parietal, the frontal bone, is the one that will close early, like between 2 and 4 years. And then the fontanelles, these are portions that have not yet ossified. Can you see we have got the anterior fontanelle and it looks like a diamond right there. You have got the posterior fontanelle, and then you have got on the sides the sphenoid fontanelle. This one is in front and anterior, so we also call it uh, anterior lateral fontanelle. And then we have got this one which is posterior and it is in the lateral side. We call it the posterolateral fontanelle or the mastoid. We call it mastoid because it is near the mastoid process. The mastoid process is a process which is part of the front of this bone here, which is the temporal bone. We'll discuss that. So of these fontanelles that we can see, the lateral fontanelle and the occipital, so these ones which are these ones on the lateral aspect, they are the ones that will be able to close very early. The posterior fontanelle, this one, the posterior one here, this guy closes between 6 and 8 months. The one that is in front is the one that takes more time to close, like up to 2 years. So like 18 months to 2 years. Is there any question before we start looking at each bone, the features that we should be able to know? Is there any question? Okay. So looking at each bone and the features that are important, starting with the frontal bone. This bone that you can see in front here is a frontal bone when we take a sagittal section. That's a view. And then if we take a section like we move the calvaria, we'll remove the bone, the part that is on top that covers the brain. This is what we are, and then we are looking at it from the top. Like you've removed the part, the top part of the skull that covers the brain, and then you start looking from the top. This is what you're going to be able to see. and the one in blue here is the parietal bone. Sorry, the frontal bone. Okay. So the frontal bone is one of those bones that will be able to form a covering for the brain or the cranium. And the frontal bone has got different parts. The first one is the squamous part. Squamous means flat. And this squamous part has got what we call sinuses. Sinuses, these are air filled spaces. The reason as to why the head has got sinuses is because it could have been very heavy because the bones are a lot. That's why you have got these spaces. Can you see this space here? That is a frontal hair sinus. Okay, you have got the air sinuses. When you look at the inside of this bone, like the inner aspect, you are going to have the sagittal sulcus. And the sagittal sulcus, like just where we have cut, we've made a cut so that we can look at this bone like this. We have got the sagittal plane. So following that sagittal plane, we did in second year, we looked at the spinal cord, and we said the spinal cord is covered by meninges, dura mater, arachnoid matter, and pia mater. Those same meninges are the ones that cover the brain also. So what you're going to see is that those meninges will actually come and make a fold that will follow this same part where we've cut this bone. There will be a meninge that will come and separate the brain into the left part of the brain, which we call the left hemisphere, and the right hemisphere. And in that groove, we are going to also see what we call the superior sagittal sinus. This is going to be an interesting topic we'll discuss. The sinuses, these are big veins, okay, that will be collecting blood that is coming from this head. So I've got the sagittal sulcus. We also have the frontal crest. The frontal crest is, I hope you can see like this one. Can you see where my cursor is pointing? Here. Remember, we're looking at the inside of the bone. So you have got more like a prominence here. That is the frontal crest. And the same thing that I've said separates the brain in the left to the separates the brain into left and right. We call that as a falx cerebri. It is like a tent that will be able to separate the brain into left and right. It will actually come and attach here on the frontal crest. Okay, it's the extension of the sagittal sulcus. This frontal crest is the extension of sagittal sulcus. The sagittal sulcus will continue. It will continue going like this, continue going like that, continue going like that around the head. But here it becomes more a bit prominent, and we are now calling it the frontal crest. The frontal bone has got also the groove for the anterior meningeal artery. You can actually even see them. Can you see? I hope you can see these tumor lines that you can see in these bones. Can you see them? These tumor small lines that you can see in these bones. So we have got what we call the middle meningeal artery. It has got the anterior division, the middle division, and the posterior. Specifically, the anterior division will form grooves in this bone, the middle meningeal artery. Okay. So the anterior division of the meningeal artery, not middle meningeal. Middle meningeal will be another branch of the meningeal artery. So the meningeal artery is going to have the anterior, middle, and posterior. The anterior, to be specific, is going to form grooves in the frontal bone. Just think of frontal is in front, right? So that is important to know. And then you are going to have the supraorbital foramen. Supra means on top. Orbital, remember the orbit. If this was it's just that we have cut and we're looking at the middle, but somewhere here, that is where the orbit is going to be, right? The part where the eye is kept. But on top of the orbit, we are going to have the small space. We call it the supraorbital foramen. And the supraorbital foramen is going to have the supraorbital nerve, artery, and vein. Like, can you see this space here? This is the infraorbital foramen. A foramen is an opening. Because it is below the orbit, we call it infraorbital. But the one that is on top of the orbit, that's the one we call supraorbital foramen. Hope that's okay. So what are other features that you need to know about? So we have said that the frontal bone has got first the squamous part, the flat part, and the flat part is the one we just discussed by looking at what we find inside the flat part. We are going to find the part of the frontal bone that will make up the orbit. Okay, it will actually form the roof of the orbit. Remember, roof means on top. So here, can you see this is gonna be supposed to be the orbit, and that's the top there. And you can see this come a small space that is the supraorbital foramen there. So that is it. And then when you view from below, like when you're looking from the down, can you see the way this bone is here? We what we are looking at here, we are trying to look a bit from the down aspect. Okay, you can see what we are saying, the sagittal sulcus. The a sulcus is a space that is made, or more like a groove that is made. This groove here, we are looking at the inside of the frontal bone, not from the outside. This one here on top is from the outside, and this one we are looking at from the inside. So this is the sagittal sulcus. Okay, there. And when you look at the frontal bone, you are going to have what we call the lacrimal fossa when you get to look from the inside, and you are looking from the anterolateral, anterolateral portion. It is in the front, but on the sides. Okay, can you see these sides here? Here, this is where the lacrimal gland is going to sit. The lacrimal gland is that gland that gives us tears. That is where it actually sits. Another prominent thing that you need to know, but it is in front, but on the medial aspect. The lacrimal gland is on the lateral aspect. On the medial aspect, you're going to find what we call the trochlear fossa. The trochlear fossa, it's going to be on the middle aspect here. It's an important one because as we start looking at the muscles that hold the eye, or the eyeball in place in this canal, sorry, in this space where the eye is found, you are going to find we have got we have got different muscles. Okay, the trochlear fossa is going to be an important one that will be holding what we call the superior oblique muscle. So please just take note of that. And then the same frontal bone is going to have the aspect that will also form part of the nose. That is the nasal part. Okay. So that is at least what we have to know about the frontal bone. Is there any question? Any question about the frontal bone? Please be free to ask, because these things, as you get to go, if you are leaving them unanswered, they'll be piling up and it's gonna be bad. So ask in case you have got a question while it is still there before night comes. When you look at the parietal bone, this is the bone that you can see, and these are actually two bones separated by the sagittal suture. You are going to have two lines which you call the temporal lines, which are going to be able to continue. Can you see this line starting from here going like that? So I've got the superior temporal line, and then we are going to have also another one which is a bit down. Hope you can see it. That's the inferior temporal line. So these are continuing from the temporal bone going all the way to the parietal bone. And these are going to be important because just this kind of space here that you can see is an important space. We call it the temporal fossa. So the limits of the temporal fossa is these same things we are calling as the superior temporal line and the inferior temporal line. It is going to be a topic, the temporal fossa. So don't worry about that very much. And it's actually to these temporal lines that we are going to have the attachment of what we call the temporal fascia. Temporal fascia. And then we are also going to have the muscle here. It's a muscle of mastication which we call the temporalis. On the top of the superior temporal line, this same line that you can see here, we are going to have a very long muscle that will start from the occipital end here. It will go all the way and reach to the front. We call that muscle as the occipital frontalis because it comes from the occipital end to the frontal end. But what happens for this muscle is that in the front it is the muscle, at the back it is also a muscle. So in front we call it the frontal belly of the occipital frontalis. Behind we call it the occipital belly of the occipital frontalis. And then these two muscles are going to be connected on the middle here. There's going to be an aponeurosis. An aponeurosis is just a connective tissue like a tendon, and yeah, like tendon. It's just a connective tissue that is going to be able to connect these two muscles. So we call that connective tissue as a epicranial aponeurosis, which will be able to connect the two bellies of the occipital frontalis. It is also known as the aponeurosis of Galen. Okay, the same epicranial aponeurosis. Epi means on top, cranial means the cranium, which is basically this part that covers the brain. So the name shouldn't confuse you too much. Epi on top of the cranium, epicranial aponeurosis. So we are saying that to the superior temporal line, on top we are going to have the epicranial aponeurosis, and down we are going to have the temporal fossa. The inferior temporal line is going to also form an arch just like the superior temporal line, and is going to be the origin of the temporal muscle, the inferior temporal line, or the temporalis, which is a muscle of mastication. When you look at the inside, this is the inside. This bone that is in blue, is it blue? What color is this? This is the parietal bone. The one in front is the temporal. Can you see what I was talking about? This prominent thing. This is what we are calling as the sagittal suture. Is this one on the middle? Okay. And can you see this continuation? We said that this is the frontal bone in front. We said that we have got the frontal crest. This is the frontal crest that is in front here. And then we have got a bit of sulcus just on this frontal, in this prominent thing that we can see here, where there's going to be the attachment of what I just told you, that is a falx cerebri, that to be able to divide the brain into the left hemisphere and the right hemisphere. So this is where the falx cerebri is going to run all the way until it reaches to the frontal bone, and then all the way until it reaches somewhere on the occipital bone. And some features you should know is you have got this point where you are separating the two parietal bones from the frontal bone. We call that as a brygma. Okay, the brygma. And then you have got the point where you're separating the two parietal bones from the occipital bones. We call that as lambda. That is that. And then other things that you can see on the parietal bone. Can you see these lines? These are actually grooves of the meningeal artery. We say that the anterior meningeal will form the grooves in the frontal bone. But the middle meningeal, you can see it forms these grooves, right? These grooves, a lot of these grooves in the parietal bone. The middle meningeal again has got different parts. It has got the anterior, the middle, and the posterior. So the middle branch, the posterior, the middle, the anterior branch, and the posterior branch of the middle meningeal. That's also important to take note. And you can as well see these, they are more like someone has gotten a needle and then they are piercing in the bone. We call these are the granular fovea, these things that you can see. So the granular fovea, these are depressions or pits that are found in this bone. And actually on the granular fovea, we have got what we call the arachnoid granulations. These arachnoid granulations are important in such a way that what happens is that when cerebrospinal fluid is produced, it's going to flow throughout the body, is going to be moving, but it has to come back to the veins, and it will actually pass through these same arachnoid granulations on the granular fovea. Please take note of that. It's important for the flow of cerebrospinal fluid. We'll discuss about the flow of cerebrospinal fluid in neuroanatomy. They can actually bring for you a question 10 marks right about the flow of cerebrospinal fluid. Is there any question about the parietal bone? Any question? Okay. Now we look at the temporal bone. Here is a temporal bone that you can see. The temporal bone has got different parts. You have got, look at this bone. Can you see that the temporal bone is connected to this bone here? We call it the zygomatic bone. And together, this part, you have got the part of the zygomatic bone and the part of the temporal bone. We call this as a zygomatic arch. But the zygomatic arch has got both the temporal bone and the zygomatic bone. So the way you are going to name these parts is, you have got, for the zygomatic bone, you are going to have the zygomatic bone, because it is attaching to the parietal bone. You have got what we call the parietal. Sorry, the zygomatic bone is attaching to the temporal bone, right? We have got what we call the temporal process of the zygomatic bone. So if you hear temporal process, it means that that thing is actually not part of the temporal bone. It's coming from the other name that you are going to hear. So temporal process of the zygomatic bone means that part of the zygomatic bone that will be able to attach to the temporal bone. And then this part of the temporal bone, we call it the zygomatic process of the temporal bone. Just like also on top here, can you see the top here? This bone on top is known as the frontal bone. This bone down is known as the zygomatic bone. So therefore, this part of the zygomatic bone is going to be known as the frontal process of the zygomatic bone, while this one which is on top is going to be known as the zygomatic process of the temporal bone. That is how these parts are named. Okay. So here you can see the zygomatic process. Please, in the exam, don't just say zygomatic process, zygomatic process of the temporal bone, because we're also going to have the zygomatic process of the frontal bone. So this is the part here. You also have this part, we call it the squamous part because it is flat. So the squamous part of the temporal bone. And then you also have the tympanic part. Tympanic is related to the ear. So this part is related to the ear. And then coming from the tympanic part, you have got the styloid process. Okay. And then we have got this big part here. We call it the petromastoid. Now this thing has got two names in it. You have got the petrous part. The petrous means hard. So the petrous part is actually going to be seen inside, like on the inner aspect, while the mastoid part is going to be on the outer aspect. This part that is prominent down here is what we call the mastoid process. You can even touch it yourself. Like just behind your ear, you can touch, you are going to feel the hard part. That's the mastoid process. Okay. So these are the parts of the parietal of the temporal bone. When you look at the styloid process, there's going to be attachment for muscles and ligaments to this same styloid process. For example, I've got what we call the stylomandibular ligament. The stylomandibular ligament, this is a styloid process. Can you see? We're going to have a ligament coming from the styloid process, going to the mandible. We call that as a stylomandibular ligament. Besides that, this ligament is actually part of what we call the TMJ, temporomandibular joint. The temporomandibular joint, this is the mandible. Can you see the mandible here? And then this is the temporal bone. So this joint that is formed here is known as the temporomandibular joint. It's a very special joint that you need to know. It's actually that's why the mandible, the mandible is the only bone on the skull that can fully move. The rest of the bones don't move. It's because of this bone, this joint, the TMJ, temporomandibular joint. Anything else that we should know? The zygomatic process. The zygomatic process, you can actually palpate it. You can feel it. Okay, you can feel it. And then you have got the petromastoid part. The petromastoid part, this is having two parts, the petrous part and the mastoid. I said that the petrous part is more inside. Okay, and this part is actually going to store. Remember, we earlier on we talked about the contents of the parts of the ear. I've got middle ear, the external ear, the middle ear, and the inner ear. The inner ear is actually stored within the temporal bone. Like you can see, this is the temporal bone. Okay, and then the mastoid part, you are going to have the mastoid air cells. Down here I've got the mastoid process. The mastoid air cells are also clinically important. These are hollowed out areas. You can see the way they look. And they are a reservoir for air to be able to equalize pressure within the middle ear in the case of auditory tube dysfunction. Auditory tube is the tube that allows us to hear. The same thing, the external ear, when it's being connected to the middle ear, you have got the eardrum. You're also going to have what we call the Eustachian tube, but that Eustachian tube is going to connect the middle ear to the respiratory system. That is why, sometimes you feel like your ears are closing, and then you be like you take some air through your nose, and then it seems as though the ears have opened. That is because there's a relationship between the respiratory system and the ear, the middle ear. That is the temporal bone. I think that's what we need to know. Sometimes there can be inflammation of these hair cells here that we call it mastoiditis. Every time you hear a word that ends in titis, that is inflammation. Eh, Mastoiditis, cholecystitis, appendicitis, anything with citis is inflammation. And then for the sphenoid bone, a sphenoid bone is a very interesting bone. Can you see this bone that is here? The one in front here is the temporal bone, this one. And then you can see the one that is in green is the parietal from talking about. And then you have got also this big bone that is down, that's the temporal bone. The sphenoid bone is the one that you can see here, and you can also see it here in yellow. So the sphenoid bone actually looks like a butterfly or a wasp. Let me say a wasp. That's why it is known also as a wasp bone or butterfly. You can see the way it is. It's a very interesting bone. It has got different parts. It has got a body. The body is like the biggest part that you can see in blue there. And then it has got the greater wings, just like a butterfly. Okay, it has got greater wings and lesser wings. The greater wings are these that you can see here. The lesser wings, these are the ones that you can see in a green. And then it has got the pterygoid process. Okay, these are the ones that you can see here. For the pterygoid process, again, you have got the lateral pterygoid plate, and then you have got the medial pterygoid plate. When you look at the greater wing has got openings. Please, you need to know them, all right? You need to know them. Three important openings in the greater wing. You have got the foramen rotundum, that is the frontmost, and then you have got the foramen ovale, that's the one that follows, and then you have got the foramen spinosum. So this bone will actually be connecting. Can you see on top here? What you can see on top here, you are going to have the brain. So some contents will be leaving the brain and they'll be going out. Some of them. So these spaces that you can see, these are the ones that you can see here. You can see these spaces, these ones. So these spaces will allow the transmission of contents coming from the inside of the head, going let's say to the eye, like things like nerves, arteries. So that's important to know. Please don't forget foramen rotundum, foramen ovale, and foramen spinosum. You can use the rose, but that's R O S, rotundum, ovale, spinosum. We are going to talk about what passes here. But can you also see that there is this space? Look at this space between the lesser wing and the greater wing. We call this as the superior orbital fascia. This fissure is actually opening in the eye. I can show you for that sake. Can you see this opening here? inside the eye. This is the superior orbital fissure. That's the same one that you saw there. This is the opening. Okay. Can you see that you also have what we are calling as the optic canal on the medial aspect? This one, the optic canal, it's also there. You can see this is the canal here. That's the optic canal. Even from the word optic canal, it will be able to transmit the optic nerve. That's the nerve that helps us to be able to see. Superior orbital fissure has got a lot of contents, and we are going to look at all the contents as we look at the orbit. You need to know the contents from top to bottom. They can bring that in your practical test exam and in your theory exam. Do we have any question here before we move on? Any question? Okay. So, looking at the different parts of this sphenoid bone, starting with the body, it is important for you to take note that the body has got what we call air sinuses, just like we had air sinuses from the frontal bone, right? We said the frontal air sinuses. I didn't talk much about the air sinuses for the frontal bone. You need to know where they open. So those frontal air sinuses will actually open in the nose, specifically in specific region, but we'll talk about that when we talk about the nose. The sphenoid air sinus is also specifically open in the nose at a specific area, but that will be a discussion when we talk about the nose. Some landmarks you need to know when you're talking about the body of the sphenoid is what we call the sella tussica and the chiasmatic groove. The sella tussica, look at this bone the way it is. Can you see this top part here? This is the body, right? That's where we have got what we call the sella tussica, the top part. And this is the same bone here. You can see this part. Again, the canals we talked about. Can you see the optic canal there? We have got the superior orbital fissure there. We have got the foramen rotundum, and then the foramen ovale, and then the foramen spinosum. Okay, these are in the greater wing. At this point, this is where we have got the sella tussica. Can you see 7 pointed? Why should you know about the sella tussica? This is where the pituitary gland rests. That is where it stays, the pituitary gland. Specifically, there's going to become a depression here. We call that depression as a, remember the pituitary gland is also known as a hypophyseal cerebri, hypophysis cerebri. So we call this opening here as a pituitary fossa because that's where the pituitary gland stays, also known as hypophyseal fossa because that's the other name for the pituitary gland. Again, another thing you should know about the sella tussica is in the front we have got what we call the tubercular sella. This is the tubercular sella in front of the sella tussica. And then behind of it, we have got what we call the dorsum sella. Dorsum means behind, isn't it? So dorsum sella, tubercular sella, right? And then between the two, we have got the hypophyseal fossa, also known as the pituitary fossa, where the pituitary gland stays. So in the exam, if they ask you what's the exact location of the pituitary gland, you are going to say the hypophyseal fossa, which is specifically found on the sella tussica, okay, which is part of the body of the sphenoid. And then the chiasmatic groove is a sulcus formed by the optic chiasm. You know the optic chiasm. Okay, we can describe this. The optic chiasm is formed in. Hope you are going to follow this a bit because I'm not writing on the board. You have got the eye. From the eye, you're having a nerve which is known as the optic nerve. The optic nerve from the left eye and the right eye are going to join. That will form what we call the optic chiasm. The optic chiasm now will send off again two branches or continuations that are going on the left side and on the right side because those are the optic tract. Remember when we say tract, it is part of the central nervous system. Okay, if we say nerve, it is peripheral nervous system. So we first have optic nerve, and then optic chiasm, and then optic tract. And then that is going to go to what we call the lateral geniculate body. That is a pathway for sight or vision. We'll discuss it in neurophysiology and in neuroanatomy. For now, that is enough. So the sella tussica is surrounded by the anterior and posterior clinoid process. anterior and posterior clinoid process. Can you see this prominence here? That's the anterior clinoid process. And then this prominence here, that is the posterior clinoid process. The anterior clinoid process is going to come from the lesser wing, okay? From lesser wing, because this is the lesser wing. While the posterior clinoid process comes from where? From the dorsum celli. Hope that makes sense. And these guys who are talking about the clinoid processes, there's going to be attachment for what we call the tentorium cerebelli. Earlier on, I told you that the left hemisphere of the brain and the right hemisphere of the brain are separated by what we call the falci cerebri. Please take note, cerebri. But this is tentorium cerebelli. Cerebella is cerebellum, that little brain. So this tentorium cerebelli is actually going to separate the cerebrum from the cerebellum. It's a tent. Down you have got the cerebellum, on top you have got the cerebrum. That's what we call the tentorium cerebelli. Okay. And then again you can see what we are calling as the sphenoidal spine coming off from the greater wing here. These are the major parts that you need to know. So just to show you what I was saying, this is the bone here again, the sphenoid bone. You can see in the body we have got the sphenoid hair sinuses, these ones. They are actually opening in the nose, specifically where the superior part here. So for the superior part, for the nose, you have got concha, the superior nasal concha, middle nasal concha, inferior nasal concha. And I told you that the inferior nasal concha is actually a bone itself, while the superior, these are part of another bone and the middle. Specifically, on top of the superior nasal concha, we have got what we call the superior meatus. On top of the middle nasal concha, we have got what we call the middle meatus. On top of the inferior nasal concha, we have got what we call the inferior meatus. And that is where actually the opposite. Down the superior, we have got the superior meatus. Down the middle concha, middle meatus. Down the inferior concha, inferior meatus. That's why we're going to have openings for these different parts, but we discuss those. Can you see the pituitary gland resting in the pituitary, in the hypophyseal fossa, part of the sella tussica? Behind here we have got the dorsum celli, okay, and then in front, that is where we have got this tubercular celli. The greater wing, as we said, it has got three foramen: foramen rotundum, foramen ovale, foramen spinosum. When you talk about cranial nerve number 5, the trigeminal nerve has got three branches: the maxillary branch, it has got the mandibular branch also. So these two branches of the trigeminal nerve. It also has got the ophthalmic, which goes to the eye. But specifically, the mandibular and the maxillary will pass in these canals. Foramen rotundum, the first one, will be for the maxillary. Just think of this. Rotundum is the first, right? And maxilla, the maxilla is on top of the mandible. So you can relate them like that. Maxillary nerve, which is a branch of the trigeminal, it's passing through foramen rotundum. The mandibular nerve is through foramen ovale. Foramen spinosum is where we're having the middle meningeal vessels. Remember the middle meningeal, those ones which are forming those markings in the temporal bone? Yes, that's the one. These are just the major contents. These are not all. Because if you just look at they actually have a lot of contents. I've just given them for now here because we are going to have a topic or specifically talk about the foramens of the skull. So you know the contents. At least for now, if you can know this, it will not be too bad. When you look at the greater wing of the sphenoid, it is going to form it will form part of the floor of the middle cranial fossa, the lateral wall of the skull, the lateral aspects, as you saw from the picture here. You can see the lateral aspect. Okay. When you look at this bone again, here, Inside, when you look at the skull, we have got fossas. This fossa that is in front here, this depression here, we call it the anterior cranial fossa. And then we are going to have a cranial, another fossa here, which we call the middle cranial fossa. The posterior cranial fossa is this one, which is down. Okay. Again, you can see, and anterior cranial fossa is this one. The middle cranial fossa, I hope you can see that there's a depression here. That's a middle. The inferior cranial fossa is this one, this depression that is very much down here. Okay. So these are the cranial fossa, and we are saying that the sphenoid bone forms part of the middle cranial fossa. Hope that makes sense, and it will also form the posterior lateral wall of the orbit. It is also found in the eye, posterior lateral aspect. The lesser wing of the sphenoid, we already did mention about it.